Hi, congratulations. So we are pregnant. So how would you feel in pregnancy is everybody's questions. Well, symptoms vary from one person to another person, and you would find that, even when you were pregnant the first time versus the second time, the symptoms can be different. Third time, it can be different. But there are certain symptoms or certain feelings that most of the women go through during their pregnancy. So most of the people have a little bit of nausea in their pregnancy. Well, even if you don't have any, you're normal. Some people even ask me, well, I have no nausea, am I normal? Majority people have some kind, and it is possible that you may vomit occasionally. It is possible you may not vomit, but nausea is fairly a common symptom. That is what we call as a morning sickness. We will be dealing more about individual symptoms in our later on videos, but this was generally, just to apprise you, because a lot of women also have nausea before their pregnancy test comes positive. So it's a very, very, cliche symptom. Then also you would notice that your breast size is appearing bigger, your breast seems swollen, they may be tender, somebody touches your breast, you might feel little pain, you don't want to be touched, you don't want to be wearing tight undergarments. So all those things are also very common. You might want to rush to the toilet very often because your now kidneys are working overtime. Your heart is also beating extra fast. On an average, it increases the beats by 10 beats. So you might feel little pounding, you might feel little palpitations, which are normal. You may also feel that, your lungs you're getting little more breathless while talking, say fast, or little jogging, or, that is because your lungs are now getting filled with the blood, which will eventually go to the baby. So your lungs are very full of blood. So a little bit of breathlessness is common. But not if it's something is making you really restless, please go and talk to your doctor, because this is not something that I can say that you should ignore. Anything which makes you uncomfortable, please go and visit your doctor. Also, one thing I want to point out, that a lot of times little bit of lower belly discomfort may be a normal finding. The reason is, there could be a slight pressure on your bladder. There could be slight funny feeling, but that discomfort is like to the tune of 1 to 10, 1 out of 10. So if you have more, I would definitely recommend, let's just find out first, is the baby in the right location, and if there is no urinary infection. So just to kind of give you another wholesome this thing about your symptoms, nausea and little bit of vomiting is fine. Little tiredness is okay. You might feel very exhausted by the evening. You may not want to talk to anybody. You may just want to rest. It is because your body is undergoing so many changes. Nature makes you feel tired. Nature wants you to rest. So these are then your breast changes, your heart changes, your breathlessness. Only thing is your digestion goes very weak in pregnancy. So you need to learn to listen to your body. I keep saying that, digestion, all these organs are running very fast, but digestion takes a back seat. It slows down. You take longer to digest your foods. You may have little flatulence. You may have little burping. You might be farting little more, especially if you're on progesterones for pregnancy support. So all these things are fairly the normal symptoms of pregnancy. Well, pregnancy is a fantastic time to look forward to. It is really, really great. But then I keep saying, normal versus abnormal, there is a thin line. Anything which makes you uncomfortable, please have a word, make an out of schedule appointment, and come and visit your gynecologist or your physician if you are not very sure of those. So that's all for today. We'll be talking about individual symptoms, what is normal and what is the fine line, that where do we cut them, and keep watching for this space. Take care. Bye bye.